other topic that we wanted to chat about today, which was our internal nutrition to
Yeah.
enhance external beauty, which is something that I'm a lot more knowledgeable on
Yeah.
than
Well, that's
the
right. And I always want to know more about it too.
yeah.
You know, and yeah, as I said, in the 40s now, you're more focused on it as well, as opposed to earlier where you sort of, you know, when you don't feel that you've got those issues, you tend not to, you know, veer towards having an interest in them, I suppose. But but for me, yeah, now more so than ever. And it comes up all the time now. I guess, you know, I relate more to my patients now because of the age group now. Yeah. So
Yeah,
I think,
go on.
yeah, no, so it's a real interest to me, and I don't know much about what you do, and I just want to learn more from you because it's going to help me and my patients, because people respond better to what I do. I feel if their internal aging is good. So we have people that are non-responders and better responders, and I think that's all got to do with the internal.
Yeah, and that would definitely make sense, because I guess if your cells in your body can only be as healthy as the nutrition you put into them. So I guess if, regardless of whether it's externally or internally, if that cell doesn't have all the nutrients that it needs, it just can't perform optimally, whether it's you know, a heart, like a cell in the heart, or a cell in the lungs, or whether it's a skin cell, or, you know, cells anywhere on our body. If they're lacking, then they're obviously just not going to perform optimally. It's just that on the outside we can see it a lot more than what we can internally, and maybe it's a shame that people can't see like their internal organs, because then they might sort of go, oh wow, that really needs some attention, and be more focused. So people tend to often, if they sort of can improve their hair and their skin and their nails and all those type of things, are quite happy to utilize it. And we're lucky that now we do have the technology to be able to really make a difference to our external appearance, which I think is amazing compared to many years ago. So yeah, so I know we were going to talk about 3 specific things that I know you use personally, and I use them as well, but that are specific for healthy aging internally. And so we can have a chat about those, because I know that you've used them for, well, some of them for a little while, and then the collagen just come out recently. How are you finding the collagen so far?
Yeah, I think I'm almost 2 weeks now. So all I know is it tastes really good and the bottle looks very attractive. So my kids keep asking, "Oh, what's that, Mum? It looks yum." And I'm like, "Damn, it looks too attractive." And it tastes good too. No, I actually find, well, it's pretty good. Like, I mean, my skin's always been okay because I obviously have had access to active skincare and injectables for a while. But the things that I'm paying more attention to is, I guess, face in dynamic. So when you smile and scrunch your face up, you know, there is small tetherings that I can see. So I'm really eyeballing that change. And I haven't actually taken my raw photos yet, like I know you have, and have got pretty good results so far, which is amazing. But yeah, I will. I had a bit of a breakout recently. I think it must be hormonal, so I'm waiting for like the red dots to disappear.
Clear up. I was surprised, as I was saying to you before. I generally like to try something for a significant amount of time before I say too much about it, but I have definitely noticed, as I was showing you before, some of the lines on the side here, and as we were saying, I don't look after my skin well, so I'm a very good candidate to see the changes, because I've changed nothing else in my lifestyle. So if I get changes, it's purely from the Marine Collagen that we're putting in. So that's going to be really intriguing. And I know we spoke about it on another call, how valuable it was, and the research that's gone into it, plus with the vitamin C, the biotin, the zinc, and all the the other ingredients that have gone into it to make it really fantastic for the skin. So, and I guess, as we were sort of talking about before, I guess it's not just also our skin in terms of the face that it will help benefit as well. It'll be the other areas, won't it? So the chest and the arms and some of those other areas. Because do you treat people also down, like, for other areas of their skin, or are you primarily face? Or
primarily face, but it does extend to the neck and décolletage, you know, where the sort of more sun damaged areas are. So the collagen elixir that we're talking about in particular, which is the new product, it actually is the marine collagen, which is interesting because I was reading up a bit more about it, that all different types of collagen, and in anti-aging, we're really only interested in type 1 collagen because that's the collagen that we know is more predominantly in the skin, and that's why we age, is because we lose the type 1 collagen. So we're always trying to promote type 1. And I know type 1 is probably the most prominent collagen type in the whole body, in fact.
Well and truly, yeah, it's a huge percentage. So and that's amazing. So I think it'll be interesting also to see if people start to also notice maybe in their arms or legs and different areas of their body. And that's going to be an interesting thing to see down the track as well. But I'm fairly sure people are going to notice changes as well. It's just, I guess, the face we tend to focus on a little bit more. So that's,
I think hair, face and hair, skin and nails is probably what people would probably visibly would be able to tell, I would feel. And just overall skin texture, I think, if people have issues.
So that's going to be exciting. And from my perspective to it, I mean, I know it does have a little bit in it that may also help with ligaments and things like that as well, which is in my industry is important as well. Although we do have the bone broth that will help a little bit more for that, for people for ligaments and tendons. But which could be interesting, because you were saying before about the ligaments and tendons getting a little bit more loose in the face. So I guess that in itself is also probably going to be as enhanced as well from people taking collagen as well to strengthen those, which I would imagine would have a beneficial effect. Is that correct?
Yeah, I would think so. Yeah, if that's what all the collagen broths do help with the body ligaments. Yeah, I would think so. Yeah, but so I'm on both types to cover both.
That's like have both. So that also would help enhance, like with, I know that you train and you have a personal trainer and do strength training, so that would also help enhance in that respect as well, because the other types are more effective with like joint health, ligaments, tendons and things like that. So having both can be really beneficial for all over health.
Definitely.
So
would you say it sort of helps like more with people that have, I guess, wear and tear of joints? Is that, I mean, that's probably one of the main reasons why people would take it.
Yeah, it would be beneficial. I mean, you can't say that it's going to treat or cure anybody that's got significant injuries, but it does help with like the rebuilding and strengthening. So yeah, definitely could be beneficial in that respect as well. So so I think that's the benefit of having the different types of collagen into your body as well. So whether you combine, and I know you can have the marine collagen and the bone broth on the same day, and that's totally okay. There's no problems with that as well. So I'll be doing that. Awesome.
I mean, look, for me, I inject so much of it, it only makes sense to start drinking it. Otherwise it's crazy.
And I think it makes perfect sense, doesn't it? Because that's what we're sort of like all talking about, is making sure that you have everything you need internally, but if you're definitely putting on the external side as well, then you've got both ways it's working, which is just incredible. So
and look, when we're injecting it, we're basically, as I said, targeting the areas of volume loss. So we're not actually coating the whole face with these injections. And most of the time it stops at the face and doesn't continue downwards. So if you're taking it internally, it just makes sense, because then your whole body will benefit and can join everything together.
Which is fantastic, because I know Nikki was saying earlier that a lot of people do, sometimes they just focus sort of, from shoulders up, but then isn't it nice if you can have the body to sort of match the work you've had above the shoulders, so that they pair up quite nicely by focusing on the nutrition that comes into your body.
Definitely. Because I think people have asked me to inject patches of crepey skin, but it just seems to be a bit of a waste for me, like to sort of focus on patches, but then it's like, well, where do you start and where do you stop? So I think it's a good to complement.